Welcome to the Windsor-Essex County Health Unit's presentation for staff or volunteers in a group home or another group living setting referred to as co-living or residential settings. Please note that the information in this presentation is current as of April 16, 2020. Please visit our website at wechu.org for the most up-to-date information. This presentation provides basic information from the Ministry of Health. It is not intended to take the place of medical advice, diagnosis, or treatment. For more detailed information about the topics covered in this presentation, please read the following documents: Ministry of Health's COVID-19 Guidance for Group Homes and Co-Living Settings, the WeChu's COVID-19 Pandemic Action Plan, Guidance for Group Homes and Co-Living Settings 2020. Remember that information continues to change, so please check the Ministry of Health and the WeChu website regularly for updates. We will cover the following topics in this presentation. What is COVID-19? Developing plans and procedures to protect staff and clients. Best practices to prevent the spread of COVID-19. Cleaning and disinfecting the group home. Recommendations for day-to-day operations that can reduce the risk of spread. Screening procedures, transportation protocols, caregiving and infection control of residents experiencing symptoms, personal protective equipment and when to use it, mental health and substance use supports. By now, everyone probably already has some knowledge of the novel coronavirus disease COVID-19. COVID-19 is an infectious disease caused by the novel coronavirus SARS-CoV-2. Coronaviruses are a large family of viruses, some of which only infect animals and some only humans. Currently, there are 7 strains of coronaviruses that are able to cause illnesses in humans. Some may only cause minor respiratory symptoms similar to those of a cold, but have also been associated with more serious and life-threatening diseases such as SARS-CoV or MERS-CoV. The strain of coronavirus found in Wuhan, China at the end of December 2019 is the most recent of 7 known strains. This new strain has never been previously identified in humans, meaning no one has immunity. The best way to avoid being sick is to avoid being exposed. The virus is spread from person to person through respiratory droplets, such as saliva or mucus, when an infected individual coughs or sneezes. Because this virus is able to survive on surfaces for a long period of time, it can also be spread from touching contaminated surfaces and then touching eyes, nose, or mouth before washing hands. It can take as little as 2 days and as many as 14 days after being exposed for the first symptoms to develop. For most people, symptoms typically develop around day 5 to 6. Common symptoms include fever, tiredness, dry cough, shortness of breath, pneumonia, and in severe cases, death. Very few people will also report diarrhea, nausea, or runny nose. To date, there is no vaccine and no specific medical treatment to prevent or treat COVID-19. There are several things that group homes and co-living settings can do to protect their staff, volunteers, and clients. This type of setting should develop plans that include, but are not limited to, how to recruit extra volunteers and staff, how to arrange healthcare if residents become unwell, exposed to, or are confirmed to have COVID-19, sick leave policies, how to transport clients in non-emergency situations, how to access PPE and supplies for clients, how to access specialist services, for example, mental health services. It is also important to provide training to staff and volunteers that covers proper disinfecting and cleaning procedures, proper use of personal protective equipment, PPE, and when to use it. Surgical and procedure masks should only be worn inside residential settings if staff must have direct contact, less than 2 meters, with unwell residents. Appropriate screening procedures. For example, keeping logs of clients, include names and times of entry and exit. Next, we will talk about prevention measures that can be taken to prevent and limit the spread of COVID-19 in a group home and co-living setting. Hand hygiene. It is very important to wash hands frequently with soap and water or hand sanitizer with a minimum of 70% alcohol for 15 to 20 seconds. Ensure that all surfaces of hands are covered, for example, front and back of hands as well as between fingers and under the nails. When drying hands, disposable paper towels are preferred. Avoid touching face, eyes, nose, and mouth at all times, especially with unwashed hands. Respiratory etiquette. Remind or help residents to cover their nose and mouth with a tissue or into the bend of their arm when coughing and sneezing, not into their hand. Residents and staff should dispose of any used tissues as soon as possible and wash hands afterwards. Physical distancing. Physical distancing limits the number of people that individuals come into close contact with. This means maintaining a distance of at least 2 meters or 6 feet, approximately 2 arms lengths, from others. This may require educating residents and volunteers to be mindful of their proximity to each other. It can also be helpful to create visual cues, such as tape on the floor to remind individuals about maintaining their distance. If at any point staff or volunteers do not feel they are able to protect themselves or clients from the spread of COVID-19, discontinue the interaction and notify an immediate supervisor. Recommendations for cleaning and disinfection include developing or reviewing protocols and procedures for cleaning and disinfecting. Commonly used cleaners and disinfectants are effective against COVID-19. Follow manufacturer's directions for use to ensure safety and effectiveness. Use damp cleaning methods such as damp cloths. Do not dust or sweep surfaces as this can distribute virus droplets into the air. High-touch surfaces should be cleaned and disinfected twice per day, for example, doorknobs, handrails, light switches, etc. Contaminated disposable cleaning items should be placed in a lined garbage bin before disposing them with regular waste. Monitor hygienic supplies regularly to ensure there is sufficient inventory. Ensure washrooms and other sinks are stocked with soap and single disposable drying materials for hand washing. Additional resources for cleaning and disinfecting are available on Public Health Agency of Canada's website or the Public Health Ontario website. Cleaning clothing, towels, linens, and other items in laundry. It is recommended that staff and volunteers wear disposable gloves and gowns when handling dirty laundry and then discard after each use. If gloves are not available, wash hands afterwards. If gowns are not available, do not hug laundry. Wash laundry regularly with warm water and thoroughly dry afterwards. If possible, do not shake dirty laundry. Dirty laundry from an ill person can be washed with other people's items. Clean and disinfect clothes hampers after use. Next, we will review things to keep in mind for day-to-day operations. Meals, group activities, and outings. Allow one person or family to use the kitchen at a time and clean and disinfect after each use. Suspend communal dining unless physical distancing is possible, for example, eating at different times to limit the number of people eating at once. Remove shared food containers from dining areas, for example, water pitchers. Encourage residents to remain in their room. If rooms are shared, residents should stay as far away as possible from one another. Cancel group activities and individual outings unless essential. Create schedules to use common spaces in shifts to maintain physical distancing. Residents can leave the home only for urgent appointments, arrange delivery of medications, including methadone. Avoid sharing personal or household items. Residents should not share personal items with others. Where possible, personal items should be kept separately for each resident. Clean all items that may be used by multiple people between uses, for example, toys and telephones. Home visits and visitors. Visits to family are only permitted if the resident stays with the family for the duration of the COVID-19 emergency. Home visits to family for a short time are not permitted. Use telephone or video interaction for residents to maintain contact with family and friends. Next, we will review screening practices. All group homes must actively screen staff, volunteers, and returning residents entering the residence using the ministry's self-assessment screening tool. Questions are provided in Appendix A of the document COVID-19 Pandemic Action Plan, Guidance for Group Homes and Co-Living Settings. Keep a log of residents and include names and times of entry and exit. Access to the home should be restricted to one entrance for all. Those that are conducting screening should do so at the entrance and maintain a physical distance of 2 meters. Consider placing markings on the floor indicating how individuals are expected to distance themselves from one another. Upon entry, each person should sanitize hands using soap and water or hand sanitizer with a minimum of 70% alcohol. Anyone exhibiting signs of illness, for example, coughing or sneezing, or indicate they are feeling unwell should be given a mask to wear. Screening Checklist, adapted from the Ministry of Health. The following questions must be asked as part of the screening process for anyone entering the facility. Do you have any of the following symptoms? New fever, new or existing cough, and difficulty breathing, worse than usual? Have you traveled outside of Canada within the past 14 days? Have you had close contact with a confirmed or probable COVID-19 case? Have you had close contact with a person with acute respiratory illness who has been outside of Canada in the last 14 days? Are you 70 years of age or older? Do you have a chronic condition like diabetes, heart disease, high blood pressure, lung disease, or conditions affecting your immune system such as HIV/AIDS or leukemia? If the individual being screened answers no to all the questions, they have passed the screening and can enter the home. Regular monitoring of symptoms should occur. Failed screening. If anyone entering the home answers yes to any of the screening questions or refuses to answer, they have failed the screening. If available, those experiencing symptoms should be given a mask to wear. For staff and volunteers that fail screening, let them know that they cannot enter and should go home, self-isolate, and contact their healthcare provider, WeChu, or telehealth. This applies to staff or volunteers who identify only with a history of chronic conditions and/or are over the age of 70. They are considered high risk for exposure to COVID-19. Return to work should be determined in consultation with the healthcare provider and the WeChu. Individuals who have tested positive for COVID-19 and are symptom-free 14 days after the onset of symptoms can return to work. Ensure that the supervisor is notified before the staff or volunteer returns. If a resident fails screening, shows symptoms of COVID-19, or is exposed to someone with COVID-19, they should be isolated immediately in a separate predetermined space used solely for that purpose, and testing should be arranged by calling the Windsor-Essex County Health Unit at 519-258-2146, extension 1420. For individuals who answer no to all other questions and only answer yes to questions about age, being over the age of 70, and have existing chronic conditions, these individuals should be isolated from others and kept from individuals exhibiting symptoms. These individuals are at higher risk of developing severe symptoms related to COVID-19. Sleeping arrangements. Under public health guidance for management of COVID-19 cases, congregate settings such as shelters, group homes, and households are considered high-risk exposure settings given the nature of communal living. Ideally, individuals have their own room. However, grouping of people may be required. Individuals that have passed screening and those that require isolation should be separated. For those that have passed screening, ensure the following. Sleeping arrangements are kept at least 2 meters apart. Arrange beds so individuals lay head to toe or toe to toe and do not use bunk beds. Beds should be assigned and not shared or rotated. If a resident fails the screening procedure and/or tests positive for COVID-19 and will be required to self-isolate, the room should have the following amenities. A door that can be closed. Access to a private bathroom. If this is not available, develop a schedule for shared bathroom use. The unwell person should use it last and followed by a thorough cleaning and disinfection. If a private room is not available and must be shared by both well and unwell residents, ensure the following. There is good airflow, open windows if weather permits. Residents are kept 2 meters away from each other. The unwell resident should wear a mask and hand sanitizer should be provided. If a room must be shared by more than one unwell resident with confirmed COVID-19, these residents do not need to wear a mask. Avoid housing people with underlying conditions in the same room as people with symptoms. Individuals in isolation should be provided with a boxed meal so they can eat in the room they are isolated to. provide a plastic-lined garbage bin, hand sanitizer, and tissues at their bed or beside them. The individual's symptoms should be monitored several times per day. For assistance with arranging your setting for COVID-19, contact our Environmental Health Department at 519-258-2146, extension 4475. Transportation Protocol. Individuals who fail the screening questions may need to be transported to an assessment center or to a hospital if symptoms are more severe. A transportation protocol needs to be in place to facilitate the process. Ideally, the vehicle should be large enough that the driver and unwell resident can maintain physical distancing during the transport. Unwell residents should be transported alone in the vehicle. Have the resident wear a surgical mask and sit in the back seat. The driver should also wear a mask. Open car windows if it's possible to improve ventilation. Tissue and hand sanitizer should be available for passengers. Residents should be advised to sneeze or cough into tissue or elbow and to sanitize hands immediately after. The vehicle should be cleaned and disinfected afterwards with a focus on door handles, seat belts, and window buttons. For transporting individuals who are very sick or exhibit severe symptoms, arrange for transportation through EMS or call 911 as appropriate. Residents with symptoms of respiratory illness, fever, coughing, shortness of breath, or difficulty breathing should be separated from others and their movement limited as much as possible. If the individual has been ordered to self-isolate as a result of a positive screen, it is important to follow these steps for care of individuals. These instructions are similar to those given to individuals who are caring for a household member. As identified previously, individuals experiencing mild to moderate respiratory symptoms should be separated from others and maintain a minimum distance of 2 meters at all times. Limit the number of staff providing care to the unwell individual. Ensure residents have plenty of water to maintain hydration. All caregivers should practice regular hand hygiene and wear appropriate personal protective equipment as required. Tasks that do not involve close contact or direct care with a resident suspected or confirmed with COVID-19 do not require additional PPE than what is normally used. Tasks that require close contact and direct care with residents who are otherwise healthy do not require additional PPE other than what is normally used. Staff should check in, maintaining 2 meters, on residents several times daily and log or monitor symptoms. If symptoms appear to worsen and become severe, call 911. Personal protective equipment includes items like gloves, gowns, and masks. Gloves. Wearing gloves does not replace regular and thorough hand washing. Hands should be washed before and after wearing gloves. The same gloves should not be worn to perform multiple tasks, but removed properly and discarded immediately after use. Masks. Wearing a mask can help prevent the spread of some respiratory illnesses, but it can also become a source of infection if not worn or discarded properly. If you need to wear a mask, you should also clean your hands frequently with soap and water or an alcohol-based hand sanitizer. Personal protective equipment is a key element in preventing the transmission of disease. Personal protective equipment must be used properly and safely removed to prevent contamination of clothing, skin, or mucous membranes and contribute to further spread of disease. Wearing gloves is not a substitute for hand hygiene. Staff must perform hand hygiene prior to putting on and after taking off gloves. All staff should review proper donning and doffing procedures and ensure personal protective equipment are disposed of in proper waste containers after use. Waste containers should be provided in residents' rooms for the disposal of soiled personal protective equipment. If an N95 respirator is worn, remove all personal protective equipment before exiting the room. Remove the N95 respirator after leaving the resident's room and closing the door. More resources for PPE usage can be found in the WeChew guidance document. An individual may not be able to comply with isolation recommendations due to a severely untreated mental health condition or substance use issue. Ensure that resources are shared with residents about coping with stress during the COVID-19 crisis. People with pre-existing mental health conditions should continue with their treatment plan and be aware of new or worsening symptoms. Consider specialist services that may still be needed, for example, mental health services, drug and addiction support or programming, and social workers. Those in isolation may need to refill prescriptions or may need access to daily medications such as methadone. Consider how they can continue to receive their medication. If it is not possible to have mental health and substance use specialists either in person or by telephone, refer clients to services and programs in the community. There is a list of available supports in Appendix C of the document COVID-19 Pandemic Action Plan, Guidance for Group Homes and Co-Living Settings. If at any time a resident is experiencing a psychosocial crisis, call 519-973-4435, 911, or bring them to a local emergency department. If at any time a resident is experiencing an overdose, call 911 immediately and administer naloxone. If a resident has a treatment provider or mental health provider, advise them to contact this professional for guidance on continuing their treatment plan. Additional information can be found by reading the following documents: COVID-19 Pandemic Action Plan, Guidance for Group Homes and Co-Living Settings from the Windsor-Essex County Health Unit. COVID-19 Guidance, Group Homes and Co-Living Settings document from the Ministry of Health. Healthcare resources can be found on Public Health Ontario's website at publichealthontario.ca and by reviewing the Windsor-Essex County Health Unit website at wechu.org. For any questions related to managing COVID-19 at your facility, please contact the Windsor-Essex County Health Unit Infectious Disease Department at 519-258-2146, extension 1420, or the Windsor-Essex County Health Unit Environmental Health Department at 519-258-2146, extension 4475.